Growing Generations Casual Conversation. My name's Erica Horton. I'm one of the owners of Growing Generations, and today we're going to be talking with Dr. Kathy Salari of Mitera. We're going to be covering COVID-19 during pregnancy and COVID vaccine considerations prior to and during pregnancy. Keep in mind, today is February 4th, 2021, and information regarding COVID and COVID vaccines is ever evolving. So we always recommend that you speak with your medical professional in real time to get updated information. But this is a topic that lots of folks are curious about, so we didn't want to be shy and wanted to offer this to you. We hope you enjoy.
Look at the data that has come out from the CDC as recently as November of 2020. They have a very large cohort of pregnant women, of about 23,000 of them, that had COVID-19, and they studied their outcomes and compared that to women who were not pregnant and also had COVID-19. What we see is that pregnant women who have COVID-19 do have a higher rate of complications. That includes a higher rate of hospitalization, ICU admission, as well as an increased risk for mortality from COVID-19. Now, that being said, because in general, pregnant women are young and healthy, even if I were to increase her risk by threefold or fivefold, the absolute risk, which is really the true risk a woman is more interested in for a severe outcome from COVID-19, or for instance, the worst outcome, which is mortality from COVID-19, still remains relatively low. So overall, I would say that yes, pregnancy is a risk factor in the middle of the COVID-19 pandemic. However, the absolute risk, the true risk to any individual woman remains low. And what is sometimes a useful comparison is if we were to compare COVID-19 outcomes in pregnancy to H1N1 influenza in 2009, the mortality rate from H1N1 in pregnancy was actually higher. In scenarios such as a global pandemic where you have strategies to mitigate risk, including masks and social distancing and hand sanitizing, and then in short order, vaccination, certainly we're here to support women who do choose to become pregnant during this time.
Great, thank you. And I want to talk a little bit about the COVID-19 vaccine, which I'm sure has been a very hot topic in your universe and everyone's universe. So how are you advising? Let's first talk about women who aren't yet pregnant, but are intending to become pregnant as a surrogate. How would you help someone navigate the question of, should I be vaccinated before I attempt to become pregnant?
I think the question regarding COVID-19 vaccination is an important one, and I think it is a tricky one for women to navigate right now. When it comes to vaccination prior to pregnancy, if a woman does have access to the vaccine, then the recommendation would be for her to complete vaccination prior to pregnancy. This recommendation comes from its well-established safety profile in non-pregnant adults and the high efficacy in regards to prevention of severe COVID-19 infection. Certainly, it would be advantageous for a woman to be immune or offset any risk from COVID-19 as she is embarking on pregnancy. In regards to vaccination during pregnancy, the recommendations become a bit trickier. In general, anytime we have new medications or vaccinations, pregnant women are oftentimes excluded from the safety trials. The reason for that, I think, is self-explanatory. Generally, trials are done in healthy adult volunteers first before these trials move on to pregnant women. In the case of COVID-19, the unfortunate situation here is that pregnant women are actually more vulnerable. And so they would benefit from vaccination more so than their non-pregnant counterparts. At this time, we don't have any safety studies in pregnant women. However, what I would say is that the safety concerns regarding vaccination and pregnancy are largely theoretical risks. If we took a step back and just discussed vaccination in general in pregnancy, the rule is that you are not supposed to give live viral vaccines to pregnant women. The reason for this is because women are immune compromised, and a live viral vaccine has the possibility of making her ill. The examples of those types of vaccines are the varicella vaccine and measles, mumps, rubella. These are traditionally vaccines we do not give in pregnancy. However, there are other types of vaccines that are safe in pregnancy and have been well documented to be safe in pregnancy, and that includes the influenza vaccine or Tdap, which we give in pregnancy, the tetanus, diphtheria, pertussis vaccine. These do not contain live viral particles and therefore are safe in pregnancy. Now, the COVID-19 vaccine is a brand new technology. It is an RNA-based technology, which means that what is injected is genetic material or RNA from the COVID-19 virus, and your body then generates the proteins that belong to the virus, and then your immune system responds by developing antibodies. In theory, there should not be any concern for pregnancy or the fetus if vaccination were to occur during pregnancy. However, this has not been proven by any type of trial or central monitoring process for vaccination in pregnancy thus far. The way the CDC has worded its recommendation, and this is also what the American College of Obstetrics and Gynecologists states, is that the COVID vaccine should not be withheld from pregnant women. While it is not an open endorsement for vaccination in pregnancy, it suggests that the choice for vaccination rests between the patient and her provider after a discussion. So certainly right now there are women who are pregnant who are being vaccinated. However, there are also women who do not feel comfortable proceeding with vaccination despite having a conversation regarding the pros and cons of vaccination. And certainly that decision would be respected. I believe that it will be in short order where we have some information regarding the vaccine in pregnancy, and that will likely help guide women a little bit more.
So we're getting a lot of questions from women about, I'm going to call it a rumor because I don't think it's been substantiated at this point, but a rumor that the COVID-19 vaccine causes fertility issues. Is that a question that you've received from patients, and how do you answer it?
Regarding COVID-19 vaccination and its impact on fertility, I would say that there is no substantiated data to support that the COVID-19 vaccination has any impact on infertility. I think that this is probably what I would call misinformation at this time, and probably information that is being spread on the internet. I have not seen any data to support this type of statement at all.
What do you typically say to patients who are contemplating the vaccine, either pre-pregnancy or during pregnancy, and they say, I'm just not comfortable with the limited amount of research and findings that are available at this moment in time?
When it comes to COVID-19, I do think that there is an opportunity to have a little bit more of a deeper conversation with women. And I think discussing what the true risks are of COVID-19 and juxtaposing that against what the theoretical risks of vaccination are sometimes allows women to really explore their feelings about it more thoroughly. Mm-hmm. The benefits, obviously, to vaccination are that the woman is likely going to be immune to COVID infection. The other benefit is that any antibodies that a woman were to develop does cross the placenta and has the possibility of protecting the neonate against
Mhm.
COVID-19 when born. So certainly there are considerable advantages to vaccination, and that has to be weighed against theoretical risks of some of the unknowns of the vaccine actually being tested. I think after you have a conversation with a woman and she is allowed an opportunity to explore her feelings and ask her questions, at that time, if she still feels uncomfortable, I think it is appropriate to acknowledge that she does not feel comfortable, and that's what we call informed refusal, and that is okay to acknowledge and say, in this situation, we're going to postpone vaccination until she feels more comfortable.